Real topics today. Thank you. Making noise. So the three real topics today are really the continuation. We're going to deal with really some significant players. The one that is I think the greatest number, remember my pecking order of H, we did herpes. So above herpes, tops to me is the most worldwide problem. HPV with cervical cancer, certainly an amazing amount of the statistics are alarming, and this PowerPoint has the statistics are 10, 11 years old. It hasn't gotten any better. Then we're going to take a look at trichomonas at the end. In the middle, I'll give you the same kind of presentation, hello, I typically do for HPV, for HIV, and try to give you an idea, because you might have a lot of folks talking to you here, but the reality is I was there before anybody even had a name for the disease. And all of us who were working in the medical field or training or to become part of the medical field in Philadelphia had exposure to this, particularly depending on where you are. But I digress, and I'll get started, and I'll show you that picture in just a second as soon as I get to that PowerPoint. And there's the picture. And I mean, and this is, believe me, not the worst case we've seen. I mean, and it's so they can, I mean, there's any area where you can think of sexual intercourse, these things occur. And it's not all warts. The vast majority, I'm just getting rid of it so you don't have to see the picture. We're specifically referring to so-called genital warts in the relationship to cervical and penile cancer, which they should put in. So when they talk about these papilla, most time you see a plantar wart grows in because you're stepping on it or one on your palm. We looked at a picture of that before, because you're using it and it gets pushed in. These protrude out. They have like cauliflower head projections. They've got a lot of different names that have been associated with them. And they're very noticeable, but probably a little more treatable externally. It's when they're in the internal genitalia, particularly in the female, and rectally in men and women. It is a real challenge to treat these. And unfortunately, a real challenge because people imagine their reluctance to be examined, to have to think about these things. It's just fraught with so many problems. I mean, normally warts are flat or slightly raised. They're not a terribly big deal, but some of this stuff is just beyond belief that you see. And yes, it's a significant association. And remember me telling you that 15 to 30% of all cancers are caused by viruses, and this is surely the biggest by a vast majority. So this is our third and thankfully our final visit with warts, which are by definition a tumor. Okay, that's what a papilloma is. That oma suffix is a tumor. And it's normally very benign, but there are certain types or strains that cause this problem. And you really have to be aware that unfortunately, once you have been infected, you're infected. That's the problem with herpes, which we talked about at the end of last time, and now with HPV. That understand that there's no, and we'll get HIV, and after that, there's no way of getting rid of this virus. Because of their ability to basically integrate with the host cell's chromosomes in the nucleus and reappear, and reappear with some degree of frequency or not at all. It's not easily predicted. So and notice the time from the initial infection, wherever it's located, and these are certainly the most common places, about 3 months. It doesn't mean the fact that they are not present or the fact that they have gone away does not mean you are no longer contagious. You're spreadable. So I mean, this is the hard point for effectively all of you who are going in the medical field in some way, shape, or form, maybe with an exception or two, to be able to get this information across. That the fact that you don't see it doesn't mean you can't get it or give it to somebody. That's a hard thing, seeing believing, but these are the kinds of things where it can be contagious without, and there's so many of them. And these are where we're looking at when they talk about cervical cancer. Oh, that means just in women. No. If you look up oral or throat cancer increasing, and then HPV, you will see amazing numbers in recent articles within the last weeks of the extraordinarily high frequency we're seeing. Thankfully, these are typically non-fatal cancers, and they're more treatable than, let's say, cervical cancer, but the numbers are astoundingly rising. Okay, and this is a trend that's been going on for a while. Initially, it was in, you're going to be sick when you say it, middle school, because of, and it's related to oral sex, pure and simple. I'm not being judgmental. I'm being information. Again, remember my frame of this. I have a daughter who had a baby before she was 16. What can I tell you? So it's human behavior is very difficult to control. I'm fond of saying the only behavior you can control is your own. It's something I would take to heart. But these are really significant things. And we know it's HPV. There's a lot of different types, 100 types or more. There's only a limited number. 40 are sexually transmitted. The vast majority of them are just contact, innocent contact, and really don't have any complications associated. But these 15 that are strongly related to cancer, and that's where, when we discuss at the end of this about the vaccinations or immunizations for this, where that comes from. That's when you know they're designed for this. And the information I had early on when this vaccine was being formulated, it was originally Gardasil. It was made by Merck originally, probably other manufacturers now. Merck's a big pharmaceutical company from New Jersey. They has been very effective. As far as I know, as vaccines go, very, very safe. Okay. So I mean, and it's the limiting factor when it originally came out, and the numbers have changed. They're trying to administer it early, and I understand why. It's because of this early sexual contact earlier than what was expected, because it was between like 11 and 12, all the way up to maybe like 25 to 26. That's expanded on the low end, 9 to 10, and shortened on the higher end, because by that time, if you haven't been immunized, effectively you've come in contact with that virus. If you're at all sexually active at all, in whatever way you want to describe that gives you an idea. It's, again, this is the difficulty, I think, with all of these problems. It's very hard. It's the intersection of normal human behavior, different human behaviors, sexual contact, biological urges. It's a minefield. Okay. So, and again, we pretty much know that this has to do with it's the mechanical nature of the process that plays a significant role. I'll get into it. That's there. I'm not really caring about the genomes. The smaller percentage of infections result in cancer. Takes an average of, for those cancers to develop, it takes an average of that time. That doesn't mean they can't come on faster. It doesn't play favorites. Some people, it surprises how early they might succumb or be diagnosed with this. Intercourse, asymptomatic, these are all the greatest risk factor. Goes back to what I told you before. We knew so little about how problematic these things were. They were not viewed to be dangerous until sort of a really increased degree of research and looking into all these problems down the road. And I mean, this is why you have to be informed, and why people that come into your orbit or people that you are responsible for treating come in this. Warts go away normally. A zillion different treatments, doesn't matter. They'll go away by themselves. If they're not curative in nature, they may recur. It was my experience with all the patients I had. We rarely saw recurrences until later adulthood. I typically, in my practice, I saw them before they were 20 and after they were 60 or 70. In the meantime, your immune system generally has it under control. Okay. To fair with some people, it doesn't follow it. The usual do's and don'ts apply. This is the purpose. And I mean, in the 10 plus years, the guidelines for how frequently Pap or Papa-Nicolau smears has changed. I mean, I thought at one point it was earlier, then it was changed. This has to do with the American Society of Obstetrics and Gynecology. They set up those guidelines. But the reason we have them, what we see here are changes in the epithelial cells. And we look for that. You want to see when they do a pap smear, they want to see normal epithelial cells. I explained to the other group. Okay, they'll either be normal. If the cytology, in other words, looking at the cells, comes back and says dysplasia, then you're not going to be tested. I mean, I just want to let you, so you should know what these names mean. dysplasia. It means unusual or irregular. It doesn't mean cancer. Typically, okay, rather than waiting a year, let's have you back in 3 months. Is there some underlying reason? Was there an infection, new partners, a recent increased level of sexual activity, blah, blah, blah. You look for a reason, you go, okay, we're not going to jump over a cliff here. Let's just take a look. If it says meta, remember META means beyond. It means it's beyond just normal, don't want to say it, normal activity. That requires okay, maybe we're going to have to get a biopsy and then take a look more close at the surrounding tissues and do a more thorough investigation rather than just look into the microscope. The one you don't want to hear with somebody is anaplasia. Anaplastic figures, in terms of, if you talk to a pathologist or someone who reviews slides, those are bizarre mitotic figures, chromosomes going crazy. That's a sure sign of cancer. So it's those, and then that does not bode well. I mean, it's all levels of prognosis. You see what I mean? So the worse it looks on a random screening, as you might imagine, the worse it could be for the person. I mean, it's important to understand. It's not easy. Again, I find this week to be very difficult, and more so difficult as I get older, and unfortunately, because of that, you get younger. What can I tell you? Oh, Dad, you're doing that one again, huh? Students are going to think you're nuts. So as you can see, this is the Gardasil, the original vaccine, very protective about cancers. And these are just some of the types that are in their genital warts. Part of the routine vac. This is 50, and I'm seeing now 9 and 10. Okay. I mean, when my granddaughter was born, when I had the baby, who's now going to be 24, was 24 at her last birthday. I mean, I told my daughter the same thing: get her immunized. I'm sure she did. So, and again, that's always the gold standard. If you're recommending it for your family members, you're comfortable recommending it for others. I always think that's it. And that's kind of what I have to say about this. It's when we see, particularly, you would see obstructions. People minimize these things, and they didn't really understand the long-term ramifications. But most of this, coming to our knowledge, has to do with this. That was the game changer back in 1981, but it wasn't 81. And I'm recounting a story I've already told you bits and pieces about, but it bears retelling. And I'll try to be as abbreviated as possible. Back started seeing cases when I was in training before I got my doctorate, 76, 77. We were then pretty active doing clinical things. So we're in a clinic and we're seeing a variety of patients. A guy came in, I'm going to tell you, probably in the warm weather of maybe in 1976, like early on in the summer. And all of a sudden, this guy had 2 blackened kind of growths that were very irregular, and it was inflamed around it on the top of us. We're dealing with an indigent population. This was a clinic. We got some odd cases. We got just people in normally for stupid stuff. That was just nuts and bolts stuff that wasn't suspicious. We all looked at it, never having seen anything like that before. The attending, who I knew very well, who was in charge of the clinic that day, kind of said, "Well, sir, because we all looked at it together. We're gonna go in and talk about it. We'll be back 5 or 10 minutes, and we'll let you know how we're going to proceed." And it was clear that this was a middle-aged man. I mean, we weren't that sure, but maybe there was an index of suspicion that he was a gay male, certainly a street person. And the guy said to me, he goes, I don't, and this is the attendant, I remember his words exactly. A friend of mine. He goes, I can't tell you very much about it, but this looks like Kaposi sarcoma. And he knew the literature. He's one of those guys. He said, this was described in the medical literature before 1900. He says, it's very rare to see this. I'm surprised. Okay, but it's like this, and he says it looks like a malignant melanoma pigment tumor that we talked about in derm. And when we looked at the skin, the worst one of them all. And he said, but it doesn't quite look like that. I'm a little concerned. So we went in and said, look, sir, we're going to call up. We're going to make an appointment. We're going to send you to whatever medical school, Hahnemann, Jefferson, one of the big medical schools, really a short distance from us to get a dermatology consult. Right. Absolutely the right thing to do. Don't know what happened. So I did my residency, I don't know, 2 big city blocks from there. 2 big city blocks in Philadelphia. We were at 8th and Race, 8th and Spring Garden. My residency was 8th and Girard. So, yeah, by any standard walking distance, half a mile or so. Within, I would dare say, 6 months, we saw cases in the emergency room. I mean, it was unusual in the medical literature to see one. Remember, the word AIDS hadn't come into the lexicon until 1981. And I'm seeing 2 to 3 cases of this in a 6-month span in a similar geographic area. Oh my goodness. But did we magically have an outbreak of a disease that's rarely seen called Kaposi sarcoma? You betcha we did. We just didn't know what was causing it. It wasn't until the backstory. By population percentage, the 2 largest populations of gay men were in San Francisco and in Philadelphia. There, for whatever reason, that's where the largest percentage was. It was very, very well known. That's who we were seeing it. Clear. In San Francisco, 5 years later or whatever, from that initial one that I described, this physician saw a large cluster of a very rare pneumonia because our immune system takes care of it. In 1980, in previously healthy gay homosexual men, seldom occurring in healthy people. And he said, and the CDC eventually called this AIDS. He came out with it. He was investigating, saw evidence of particular viral changes, came up with an idea that this was a viral-induced damage to our immunological system. And after this original article was published, the researchers done before that, we now got the names of human immunodeficiency virus, giving a name to this virus. That was very unique. We'll get into that in a second. And to this condition that it evolved into at that time. And we did not know if everybody was going to evolve into it because there was certainly no treatment. And these individuals were all going to die because there was no real treatment, called acquired immune deficiency syndrome. It says syndrome, they don't know. And now there's a series of what we now call AIDS-defining diagnosis. HIV positive is not a death sentence. People live normal life, not fatal, appropriate treatment that we have today, taking care of their health. The most famous of them all is a guy named Magic Johnson, who 5 championships in basketball with the Lakers, came from Michigan State, one of the all-time great top 10 basketball players anyway you would want to talk about. Basically identified himself as having developed HIV in 1991, brought a lot of awareness to how it spread, how it's not spread. I mean, this is what maybe the most visible athlete at this time, not named Michael Jordan, who was certainly the biggest athlete at that point in time. It was unbelievable. So, and there was a lot of learning that came out. He's fine today. He's an owner of the Lakers. Healthy, older, 60s now, I would dare say. Nevertheless, this is what it evolved into. What we knew, and I said, and this was the part of the anecdote because I was very familiar with it. My first wife was a nurse at that school. We started seeing each other at that hospital. Started seeing each other right away. We got engaged right away. I moved from my apartment to hers, which is in Northeast Philly, about 10-minute drive to the hospital. It was easier. She goes, oh, by the way, I'm sure I told you this. My downstairs neighbor John is gay. She goes, I have a downstairs neighbor. I have to be his date for a couple of things for his work. The Christmas party, the awards dinner, blah blah. He's a manager at a business, in a good sized business. I'm going, really? Well, that's interesting. She goes, oh, he's gay. Okay, well, I figured I might survive this, to be flip. Wonderful guy, nothing, it's well, no problem whatsoever with that. We were always good friends like that, all of us, and we pal around together. I can't even tell you how many times when I didn't have to be at the hospital, which wasn't that frequent, which I had to be at a lot. We'd sit down. Oh, we're going to have lunch today. We go down. We make something nice. We all sit around and talk. And his group of friends, who were all gay, would come over. It was, and they all called themselves girl names, which was very popular. If you study look at biographies, you can find them on YouTube of the late Freddie Mercury, who was the lead singer for Queen, and look at the images from him in concerts 1985 and 96, where you saw this one of the most identifiable, physically active, wild concerts of stadium rock of all time, and watch him in the last images they have of him doing a music video about 1990-91, shortly before he died. You would be shocked at the transition. And I'm sitting there having lunch, and they say, and these other fellows would come over, and I was very uncomfortable. It was totally foreign to me, and probably shown through, but I was certainly nice and polite. And this fellow, oh, I have to go, and you can see he didn't look good. And all of a sudden I turned, what's wrong? He goes, oh, she's got it. What do you mean? Oh, a lot of us are getting this thing, and they're getting sick, and most of them are dying. It was 1977. AIDS. So it wasn't like something new. And understand the morality of it, and understand how this is the intersection of our social mores and structure, because everybody was closeted. I told this other anecdote, and this is absolutely true. The three of us would go on like a day off or a weekend day, and we go like a lot of people do. Oh, we're going to go over to the mall. We're going to look around. We'll window shop and we'll buy a few things. And he came along with us. We drove like in one car. Oxford Valley Mall, nice kind of upscale mall outside of Philadelphia. And all of a sudden, we'd be shopping. He'd come up and tap us on the shoulder. He'd go, I'll meet you at home. Because he picked somebody up. And then by the time we got back 3 or 4 hours later, we'd be entering, because it's a common entrance. He'd open his door. Oh, it's okay. He's gone. It was a quick hookup. Everybody did quick hookups. Because nobody knew. That's the way it was. It was so contained. There were places on the weekends where folks in the know knew where to go. In Philadelphia, they went to a place called New Hope, which is near where Washington's Crossing is. During the day, it's a nice little community with candles and antique shops, and great to walk around. At night, ooh, wild. It's a gay hangout. Okay. Same thing. People, they would go to Fire Island. They would go to Provincetown for Cape Cod. That's where you went. They actually did a movie with Al Pacino. If you're an Al Pacino fan from back in the day, starting with Godfather, called Cruising. And he was a police officer who went undercover, literally and figuratively, undercover, to try to catch who they felt this guy was murdering gay men. And they actually simulated and did some of the photography in a place somewhere in New York, probably in the Village or the Lower Village, or East or West, called the Mine Shaft. And I mean, that was a notorious. I mean, the activity if I told you any of those activities, you wouldn't believe it. You wouldn't believe it. So I mean, nobody else has got this inside information. What it points to is they had to do all of these things. I'm not judgmental. Hey, be happy with who you are, or who you want to interact with, or who you want, that's fine. Be safe. Make sure everybody else in your orbit is safe. Make sure everybody in your orbit doesn't interact unsafely with people outside of your orbit, whatever. Hey, so this is the whole idea. This is what I told you. We talked about PCP pneumonia. Very, very interesting thing. Okay, great. So here's just some of these things that are part of it. So, I mean, that if it goes in your lung, coccidio, pretty common in, remember, those 4 corner states in the desert, but if it goes other than the lung, the ones you're going to probably see, potentially Kaposi's sarcoma, tuberculosis, or any mycobacterial disease, tuberculosis particularly, okay, these herpes simplex virus ulcerations lasting a month or longer, particularly the esophagus, bronchi, or lungs. all of these things. These are all about immune systems that are collapsing. It was probably explained to you, but maybe it wasn't. What it attacks is called the CD4 lymphocyte. That is a lymphocyte that's going to become a helper T cell. The helper T cell is the single most important cell in your immune system. Its name tells you all it does. It activates the innate immune system. It activates killer T cells. It activates the pathway that makes antibodies. Without them, your immune system collapses. That's what AIDS is. We used to look at them, and if we call it helper T cells and suppressor T cells, that was not as reliable index. Now we just look at, we're able to track with modern technology the number of helper T cells per microliter. And if it falls below 200, at that point, your immune system has collapsed. It invades those cells, that they die, they spread the virus, it affects other cells, macrophages, antigen presenting cells. They're all vital to your immune system, and effectively it's going to collapse. We have no way of shutting it off. Now we have treatment. And that was what I talked to you about antivirals. There was a lot of money went in from the entertainment community when famous people, and Freddie Mercury was somebody who was closeted until right before his death, he came out and said to everybody, everybody knew it. Okay. It was no big secret, but it wasn't a public secret. It was like Elton John, who came out a little bit earlier when he brought a soccer team called Watford, which he owned, which is a team in the English, relatively high up in English football, that he grew up with, loving as a kid. He had a bunch of money in watch, and then a big article came out showing him that basically, called him out with the tabloids in England are awful. And he goes, yeah, I mean, and he was going to Freddie Mercury's house, and they're trying to interrogate him about what's going on. He turned around, I'm going to visit my friend, and went back in his car and said goodbye. We just went to visit my friend. That was that kind of aggressive culture. So I'm trying to give you some of the historical references with regard to this. But because that immune system collapses, you're going to die. Most likely of infection, pure and simple. I mean, these are old numbers. As of then, 35 million people died of AIDS, over 37 million people live with it, mostly in sub-Saharan Africa. The numbers now are higher, but thankfully, because of that drug act called the Orphan Drug Act, thankfully because of the George W. Bush administration, a ton of money was put in to making these medications, which are very effective at curtailing it. Once you get it, you have a thing called the set point. That's how they judge how many viruses you typically have. And it really is a very indicator of how likely treatment is to succeed, and how you have to be cautious to what degree interacting with others. And so, and if you can lower the set point tested periodically, it's like this medicine's working. They put a lot of money into it, and again, it's not the largest killer. Malaria is a bigger killer. Sub-Saharan Africa. Okay, so they talk about, they've had some trials where they've seen some of these therapies they quote unquote said, we no longer see evidence, but there's not enough information in these isolated cases to tell you anything is ever cured. They're trying with a lot of these things. So it has contracted HIV, may not be ill. Again, when you get sick from this, you don't get sick. It's like these other things. There's no sore, there's no drainage necessarily. Could there be a rash? Unlikely. It's like I got some kind of flu bug. That's about the highlight film. And by this time, how many contacts might somebody or not have had by this time? Okay. And so it's a mild by any definition. And after that initial burst, levels decrease but persist. There goes latency. What happens is, this is a retrovirus, means it changes the RNA in its virus to DNA. That DNA joins with the host cell and basically changes that line forever, causing it to be nothing more than a factory to make viruses that destroys each of those cells and in turn affect others and alters their efficiency. And typically the average time is about 2 to 10 years, faster with some. Freddie Mercury, they made the diagnosis by way of Kaposi's sarcoma, and he led a very, the proper term is hedonistic lifestyle. Crazy. You might say, I'm a big Queen fan. I love their music. I love their performances. And what happened, I mean, he's the one who wrote Bohemian Rhapsody. It's entirely his baby, so to speak. And I mean, it was parties you could hardly imagine and probably could never forget that were there. Never, they had to hold them in some exotic places. But to see that, and from his diagnosis, he lasted maybe 4 or 5 years. It was Kaposi sarcoma. And so what happens is this latency, but it's that slow, and it changes. See the chart. So it's the last stage. The helper T cells drop, and all of these different complexes, losing weight, night sweats, just like tuberculosis, just like cancers. And you can see what I mean. If you make anything out of the chart, it's high. It goes away where it's not measurable, but over time it gradually increases and increases. So here you can see the circulating RNA levels that they can monitor with advanced techniques. And then once it reaches that, whatever that critical tipping point is, and again, it's average 2 to 10 years, big trouble. So HIV-1 is the one we see most commonly here. I mean, there's a lot of, I mean, you can look through this stuff. I'm not going to ask any questions about it. These are where we target. These are the antivirals. I talked about the nucleoside analogs, the lookalike ones. They were the earliest treatment. Now we use one of those. We inhibit the enzyme that comes with it called reverse transcriptase integrase, which allows it to join the host DNA. And typically a protease, these protease inhibitors have been around for a long time. They stop its ability to exit. So now they used to be a triple cocktail. Now it's a quad cocktail in a pill form, which is very takeable. Very complicated virus. I'm sure I told you when we talked about it initially. This came. The vast majority of evidence suggests this came from the failed polio vaccine attempt to manufacture by some low-life so-called lab that used sick monkeys on dirt floors in horrible conditions in Africa to make this on site, and got the sick monkeys, and it mixed with the polio virus because they were going to grow the vaccine and the virus, and most likely the mutations occurred from whatever virus was in the monkeys and that. And there's so much evidence to support that. But then, I mean, when it came out, it was like, oh, this is a scourge for gay people. They're getting their, oh, give me a break. There was such a lack of tolerance for people who weren't, like people, quote unquote, thought they were supposed to be. Don't get preachy. So, I mean, thankfully, like I said, you only have next week wounds. You're done with me. It's okay. Yeah, I mean, all this, and I'm not going to go into all this. This is more about a course in virology. So but they're constantly mutating. The problem is RNA becoming DNA. There's no proofreading like we had discussed. There's no magical DNA polymerase. Like when our cells replicate, we have this thing to assure there's a minimal amount of defects. Here, there's very little. It mutates so much you have to attack it in multiple ways. Just kind of like, and for long term, but effectively for a lifetime, unlike, and sometimes with tuberculosis, very, very long terms as well. Here's the helper T cells that are so significant with regard to part of this. But what happens is they just are destroyed, and that's how we monitor when we get to that 200. But the macrophages and dendritic cells also invaded. They replicate through them. They don't function normally. Immune response, and then all the bad things happen thereafter. It's present in all fluids. And so, and the reason why it was gay men is because it's anatomy. The lining and basically the way that the rectum, the anus and rectum are formed, they do not tolerate the kind of physical kind of sexual intercourse that's there, where the vagina has elasticity and has a reinforced surround that allows it to deal with that vigorous kind of sexual contact that happens. The lining tears And again, this is just modifies, it just makes the point about pre-existing or creating damage. It enables these viruses to get into your bloodstream, to invade your tissue. So it's a mechanical, I mean, it's an anatomical basis for this disease transmission. Needle sharing programs have been very effective in a lot of reasons. Again, people have different, it stops disease. That's a good thing. It's the same thing as having Narcan available readily for people, for heroin addicts. I mean, we're stopping people from dying. Are we enabling them, their behavior? That's a societal issue, not a health issue. I have to think it from the health point of it. And so, and I comment to the other group, pre-1981, you were at tremendous risk from blood transfusions, from both hepatitis C, where I'm fairly sure that my first wife got when she got a transfusion prior to 1987, because in 81, she had ovarian surgery in an attempt to get pregnant, and she had a bleed internally. They were unaware of it. They had to give her a couple of units of blood because she had a bleeding deficit and a variant of what's called von Willebrand's disease. And because of that, later on, they discovered that she had been infected with hepatitis C. It was coincidental to a blood splatter that she got at a nursing home when she was basically running the nursing home evenings and weekends. Go figure. It's still there, and it could still be dangerous to her, and her health's not great. So for all those factors, I mean, it's just a lot of stuff that's going on. But hepatitis C and HIV were part of that. And there's a lot of well-known figures prior to 1987. In 87, they started to screen very aggressively for the blood, and you can be confident that appropriately screened blood bank blood is fine. The only other blood that's safer statistically is your own. It's called an auto transfusion. You're going to have an elective hip replacement. The orthopedist might say, let's get a couple of units of your blood at the blood bank, and the hospital will hold them because you might need them. And that's the safest blood you can have. So all those types of things. And the last nugget is, it's so important to treat against vertical transmission. There's so much statistical and good evidence that this has limited the spread to the unborn child as it makes its passageway through the birth canal. And because these are carried by way of the placenta as well, there's really good evidence for the usage of antivirals to prevent. In fact, before we had these antivirals, these kids were all born already HIV positive, and most likely we're not going to have long-term survival. So I mean, all this has changed over guidelines. It's not as contagious. Hepatitis C is worse. HIV positive, 1 out of 500 on a random needle stick. AIDS, be careful. We don't have the luxury, most of us don't, in a hospital setting. If you have to go treat somebody, you treat somebody. This is why I teach it to you, so you have an understanding when to be more. You should always be cautious. Sometimes you're double glove for certain things. You're really cognizant of not playing fast and loose with the rules. All these types of things, pretty straightforward. And you can see what happens. You can see number of AIDS deaths significantly decreased as became the availability of a variety of treatments and coverage for that we're on. It's a whole laundry list you don't have to know. The antiretroviral, they call it HAART. That's a name that you might see like on an NCLEX. Be aware of that. Which is, they like proper names. They love these acronyms that are there. It doesn't eliminate it. And it's all about that set point that plays a role. Pretty straightforward stuff there. So donor and blood screening have lowered the risk significantly. Look at that, 1 in 1.5 million transfusions. Also for artificial insemination and organ transplant. All these, and we've learned a lot about disinfectants. So this is an enveloped virus and pretty easy to take care of in surfaces. You're almost done. See, and this is the second most. HPV. In between HPV and herpes, Trichomonas vaginalis. This is a protozoan. Drug of choice is metronidazole because it's an anaerobe. It's ridiculously common, and it can recur Yeah, every 3 to 6 months. So this is a protozoa. We categorize protozoa by their anatomy. So these have flagella, and they use them to move around, and they use them to attach. So and it's, I don't know how asymptomatic it is in men. I mean, it certainly has. I think it has symptoms in both, though sometimes they're less severe than more severe. But it's from, at least from my experience with patients, it hurts, both men and women. Maybe not so severe as gonorrhea, burning pain with urination, redness, irritation, pinpoint hemorrhages, preterm births become problem, discharge burning, etc. All the normal things we typically see. This is what it looks like. I mean, this is going in your urogenital system. Imagine that protozoan, and they move and they twitch. And when you take a sample of the drainage or express it from the male or take a swab from the female under the microscope, we call it twitching motility. It's a real giveaway, and then you can do additional tests, of course. Trichomonas vaginalis, that 4 of these flagella anteriorly, 1 in the back. Okay, unmistakable jerky motility by microscopy. Does not survive long outside, so it's almost surely strictly intercourse. The energy, because it's anaerobic, they don't have to know that they're called hydrogen. It gives off like little bits of hydrogen gas. Don't understand it well, particularly, again, mechanical trauma, moving protozoan thought to produce the symptoms. They don't know. Discharge, hydrogen gas, anaerobic. There's the adherence factors are there. So it's not, I mean, it's clear that it causes significant problems. But thankfully, metronidazole has been consistently very useful. Transmission usually almost only. With regard to transmission, I forgot to mention, as I did in the previous class, the only one of these I'm talking about that you worry about on inanimate objects more than others, we call fomites, is probably HPV, because it's a naked virus. I understand, I don't know how to, I've got to say it appropriately. Inanimate objects are sometimes used, depending, as my daughter would say, what floats your boat with regard to sexual activity. Enough said? There's no easy way to do this. I mean, I tell my wife, I'm sitting here, most of you, this is your grandpa telling you. I don't know what's going to happen. What's going to happen 10 years from now? I'll be coming like this with the wheelchair and the walker, and nobody, look, what the F is he talking to us about? Don't you laugh up there. Okay. Okay. Multiple partners is bad news for all of these. Mothers at birth, high percentage of asymptomatic in men helps transmission, blah, 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 blah. And I mean, I just want to show you, and we've got a couple of minutes just in case. There was a couple other little, what I call factoids, oddball things with some of these that we see a lot. This is herpes, 4 to 5 times a year. Some people as many recurrences for that. I thought these are just things I found interesting. Every year, 1 or 2 persons per million with chronic develop encephalitis. Again, like I told you, my daughter got a case of viral meningitis that the specialist was very sure was herpes. It was from herpes type 1, because she was always prone to. I mean, it was just right at the, because remember, it uses nervous pathways. So that's interesting about that. HSV, this is what I meant. The worst thing, these active infections of herpes simplex can be destructive and fatal. Underline that. Contaminated by the mother's reproductive tract immediately before and during birth. Other things, okay? Pregnant women with a history of recurrent infection must be monitored for all signs, especially in the last 4 weeks. I mean, if it's clear, fine. If it's not, C-section. That's why that prenatal care for all of these is so important. And that's where many of you are going to come into this. Typical herpetic lesion, cold sore. most of that, things that can separate. How about the numbers worldwide? These are more recent stats. 4 billion out of about 7.7 people are infected. That's why it's not notifiable. Why bother? Nearly half of the world's population hasn't have been exposed to it. Okay, trim incident, et cetera, et cetera. Herpes is more common than these, but is not a reportable disease. 50 to 90% of people are infected, don't even know it. They don't have it. I've gotten a cold sore. I get one in a blue moon. Literally, that's about the size of it. My wife gets them more frequently. Okay, and and I'm trying to think what else. No vaccine, the usual do's and don'ts. Mothers with cold sores should be careful in handling newborns. We have things. The acyclovirs have been a big help. Warts we just talked about. An old time name those, what you kind of saw was an example. What's called, you have to know it, condyloma acuminata. Okay, and I was lucky. They used to treat these with radiation. One of my gal was in nursing school, her BSN program with my first wife at Slippery Rock. She and her husband came into my office. They treated her with radiation on her foot. By sheer luck, I was able. This looked like it was going to make a change. I was really scared about this, and for some reason, my topical treatment it went away. They thought I had laid magical hands on them. I think it was just luck and good conservative treatment. The vast majority of cancers are HPV, cervical cancer. Approximately, look at this: 4,300 women die in the U.S. from cervical cancer. Men can have problems. These are more recent statistics. All the numbers that are there. This one's a little bit. All sexually active adults will get it at some time in their lives. 14%, and it's not a judgment. It's just a quote or a number. Female college students become infected with this incurable condition each year. Tests now recommended for women over the age of 30. Pap smear single best. Right now, this is one where it's young as age 9, and boys as well as girls. Repeatedly safe. The numbers are good. Nearly 100% protection against cervical cancer as well as worse. For goodness sake, why? I mean, that's why if one works, use it. I mean, I understand the concept of it's you're not being permissive with your child, but I think you get the idea. And this is the other one I talked about, the molluscum contagiosum, relatively easy to treat, frictional upper thighs. We talked about it with pox viruses. Not a bit. I mean, it's by definition, it's close, intimate contact, but thankfully, we used to just numb them and basically take an electric needle and cauterize them. If they came back, they came back. And this is the one, last number here, for this group B streptococcus. That was what they did when he did the study Semmelweis. That's what he saw with childbirth fever. This is nasty. Another one in the reproductive. Have the infants become colonized? Okay, this is not good. I mean, a lot of early onset deaths, women having problems with it, problems with pregnancies, etc. If you want to look through this, and that's everything. I'll see everybody on Monday. Thank you for being here. Thank you for putting up with